for joining us. Please give us a bit of background about yourself and your work with COA.
Well, my name's Jeff Scott. I'm a med-onc. I don't practice anymore. I founded and co-led a practice called Georgia Cancer in the 80s and 90s. I love the business side of healthcare. So an opportunity availed itself with me, and in 98, I partnered with a guy named Raj Mantina, and we started ION, which is the big oncology GPO. So we were able to provide all kinds of services to practices, networking, business education, and most importantly, better prices on drugs. So we had partnered with one of the distributors, became the largest. It was a great gig. After we finished that and we sold those companies off, we were in multiple specialties. Had a company called P4 Pathways, which allowed us to get in front of payers using a primitive data source, the claims, and to help manage an oncology program. And then always have worked collaboratively with practices to help them look at the future of how they reimbursement, how they can win with the payers collaboratively. And then after we exited that business, thought I retired.
Yeah.
Then the government passed this legislation called MACRA, which enabled value-based care at scale in oncology. So we formed IntegraConnect to serve MIPS, which is the low bar, and then the Oncology Care Model, which was the medical home. And we worked with a large number of practices to help them win. And our practices had over 100 million in shared savings checks. And that program ended.
Yeah.
And we took our learnings and I went to various payers and organizations. And now we have a similar program to OCM in 15 states.
Yeah.
With mostly the Blues payer, working with 160 TINs across the country, providing value-based care. And we've even now gone into the taking risk model.
Excellent. That's an amazing career. Congratulations.
It's been fun. It means I'm old.
Can you tell me a little bit about what you learned at COA 2025?
Well, you can see there's a lot of side conversations as much as there are in the meetings.
Yeah.
I think as a supporter of community oncology, I think we all have similar concerns. We're very excited about what happened in Arkansas, where the first state has, driven by the medical oncologists, developed PBM legislation that will allow them some more freedom and flexibility on the pharmacy side, which I think is great. Very supportive of that. We've learned about new therapies, radioligand therapy, and how that's going to become a big part of the practices. We call it Theranostics, and I think most oncology practices are just learning about it. But we look at it and we believe a third of their revenue is going to come from Theranostics in 10 years. So there was a great presentation here about that, helping practices understand what's going on. And then the undertone here is what's going to happen in IRA, and hearing a lot of ideas, but not just from the practices, but from industry. So those have been some of the big conversations we've been involved in.
Excellent. Thank you very much, Dr. Scott. Really appreciate your time.
You bet.
Thank you.